Can you hear me now, Acedia? I'm not sure because my system is working um, according to how I've set it up. Please check your system and let me know again. Or you can log out and then log back in, if that helps. And we'll, okay, so we're covering the indicative content and we're on, we're talking about the learning objective 2, which is to be able to develop strategies for leading and managing in an area of health or social care provision. So we're talking about legislative, statutory and non-statutory frameworks. And we'll talk about national legislative statutory frameworks. We'll talk about common core principles that are out there, local authority frameworks. We'll talk about organizational systems for compliance. And just a minute. Okay, yeah, this is fine. And we'll talk about proposals for change or adaptation. So change is necessary everywhere, and we have we try and use it in our systems as well. Yeah, so we go to here. So our key terminologies include what legislation is, and what are what is statutory and non-statutory frameworks for health and social care services. So legislation, it refers to the official laws that are there within the country and govern the country. So there are certain primary legislations which are known as statutes or acts of parliament, and then there are secondary legislations which are known as regulations, orders, and codes, etc. So the secondary legislation is actually something that is delegated to some third party. So for instance, if there's an organization working, or there's a school working, or there's a hospital working, so there'll be secondary legislation, and which will be imposed by the primary legislation. So the primary legislation will not impose that legislation. It will be the secondary legislation, actually. So it includes laws, orders, and codes that will be dealing with, still no audio, I will go off and on. Yeah, Leah, please do that and reconnect. So this secondary legislation is actually directed by the primary legislation to the third party. And what does legislation mean in health, healthcare, health and social care? So it's the term used to describe laws and the processes of creating statutory guidance on the rules, legal rules that affect people in the society. And what is a statutory framework in health and social care? So CQC, it's Care Quality Commission. They are statutory frameworks through which health and care services are provided and must be adhered to. So the regulations are, there are 4 regulations basically, and they're requirements where the service provider is an individual or partnership, in a partnership. And regulation 5 is fit and proper persons, like directors who are involved in it. And the 2 regulators for health and social care are mainly Care Quality Commission, which we talked about, CQC, and they monitor also. So for any healthcare services or any healthcare setup, there will be 2 regulators for health and social care. And the second is Professional Standards Authority, PSA, for health and social care. So there are certain professional standards that are there in place that must be adhered to. And what a non-statutory guidance, what does it mean? It's issued by the government of its own motion, and it has no legislative status, and it has no authority as a matter of administrative law. So they are in place. However, they don't have any legislative status. So we may need to be aware of what statutory and non-statutory frameworks are in health and social care. So how do we evaluate the current legislative, statutory, and non-statutory frameworks and their applicability to health and social care provision? So legislation must be followed. Definitely, we know, whether it's healthcare, social care, or whatever. It must be followed at all times. And this is to ensure that the services that you're providing, they're operating in the best legal and safe way. So you may go out and beyond your capacity to provide health or social care, but if it's not within the legislation, it is not allowed. And failure to comply with the legislation, this can result in an unsafe working environment. This has a negative impact on the well-being of service users, the staff, other stakeholders. So when we're talking about the NHS, or we're talking about social care setup, it will be the patients, they will also be our stakeholders. It's not just the staff and the NHS workers. It's not just the nurses, it's not just the doctors, it's the public as well. It's the people who are associated with those patients as well. That is why there must be systems in place to ensure compliance. Placidia, I hope you're hearing me well now. I'm not sure.
Yes, I am. I am now.
That's great. That's great. Thank you. And it's important that legislation that relates to NHS, social care, and voluntary sector providers, they're kept in mind, and I'm just going to discuss them for you now. So the key legislations in health and social care are mainly Health and Safety at Work, which was founded in 1974. Health and Social Care Act, it's been regulated, and it was updated in 2014. The Equality Act 2010, the Care Act 2014, Safeguarding of Vulnerable Groups Act 2006, Mental Capacity Act 2005, Mental Health Act 1983, Liberty Protections, Safeguards, and Children's Act 2004. So these are basically the key legislations that we'll be talking about. So Health and Safety at Work Act 1974. So wherever we are working, there are going to be health and safety issues. No matter how safe you say the environment is you're working in. You're also vulnerable, and you're making others vulnerable as well. You may make others vulnerable also if you're not aware of these legislations. So this Health and Safety at Work Act, it sets out an employer's duty to ensure that the workplace is safe for them to be working in. And just a minute, just making sure if the recording is in place. Just a minute, Placidia, sorry for this. Yeah. Yeah, I'm just making sure if this recording is.
Yes, it's been recording on my end.
Yeah. Because when I'm sharing my screen, I actually can't see the recording happening. Okay, sorry for that. Okay. So, and it's an employee's responsibility to themselves and to others with regards to health, safety, and well-being. So it's detailed in further regulations, which we might not be discussing, but you have to be aware about certain terminology such as COSH. So you might have seen the symbol or some of these symbols around. So they mean explosives, they may be inflammable, the environment may have inflammables, they may have oxidizing agents, they may have gases, corrosives, toxic agents, health hazards, serious health hazards, and dangerous for the environment. So you may not have them directly, but they indirectly may have an impact on any of these, like they may trigger an explosive or they may trigger a flammable. For instance, in offices, you're not allowed to use at least for us, we know that we're not allowed to use toasters there, or we're not allowed to use electrical jugs there, because there have been incidences where there has been spillover. So these spillovers might harm us, but they might as well as people who are working with us. The same goes for other appliances. So we have to be making sure that we're working according to what the legislation says. So this act, it's the basis for workplace health and safety, and it identifies the health and safety executive as the regulator sets out responsibilities for the employer and the employee. So it's not just the employees who need to make sure that they're working according to the rules set out, but it's the employer's duty as well. And the management of health and safety at work regulations, this is the second legislation we're talking about. So the employers must carry out risk assessment. So this is to reduce, or if you can't reduce, the best is to eliminate, obviously, the risks. If that can't be done, we need to reduce the risks. And procedures for emergency situations must be in place. For instance, if there's the fire alarm, that must be in place. Those drills must be in place. People who are working there must be trained enough to understand that there will be these drills and what do these drills mean. Employers must provide information and training. Then there is Manual Handling Operations Regulations 1992. So employers must assess and minimize the health risks associated with moving and handling. Employers must provide adequate information and training. This is moving and handling stuff. Obviously, we tend to move beds, we tend to move patients, but what is the best way of doing this, that we do not harm ourselves and we do not harm the people who are working with us, and particularly the stakeholders who are the patients, so they're safe as well. And then we have the health and safety display screen equipment regulations, which was set out in 1992. So employers must risk assess workstations of staff who use display screens daily for an hour or more. So there has to be training. When I was going through this presentation, I realized that I was not aware of this last point. This is something that's so important, because we teach and we study also, but I'm a student myself also, and we're working for so many hours on preparing lectures or delivering lectures or taking lectures. But are we aware that there has to be a display screen equipment? We need to be aware of these legislations, because this is indirectly impacting us. It might not affect maybe our eyesight. It might affect our mental health, or other health-related issues might occur because of them. So there's the regulatory reform, fire safety order. So the employer must take reasonable fire safety precautions. This is by completing a fire risk assessment for the premise where they're working, supply and maintain fire safety equipment, plan escape routes and fire exits, and provide information and training to employees. This is very important. When you're working in a setup, for instance, you're delivering a session also, you're delivering a workshop, you're talking to colleagues, let's say, you need to be aware, your colleagues need to be aware if they're joining you, they've not been there in that place before, but you need to make sure that you tell them about this fire safety, what measures are there, and if there's a fire safety alarm, there's no drill happening, and on that particular time, so they should be considering it as a real fire alarm, and then you should tell them what the safety exits are. Then the lifting operations and lifting equipment regulations. This is again similar to the one we talked about previously. So it's talking about regulation that specifically is for the use of equipment used for lifting or lowering loads, such as you have when you'll have patients, obviously you'll have these things working. You need to have them in place. And the employer must make sure that there's information that you have and you have been trained according to the legislation. And the equipment is also well maintained. So if there's, for instance, if you're lifting someone or you're lifting something, let's say that you're lifting a mannequin, let's say, and or some equipment that is sensitive, and you're not able to lift it properly, it may fall, you may fall over, you may harm yourself, you may harm the staff that's close to you, or you may even obviously that the product that's in your hand or you're lifting that product may also be harmed. It might not necessarily be a patient, but this has to be in place, and you need to be aware of these conditions. And then personal protective equipment at work regulations. We need, as healthcare providers, we have our gloves, we have our aprons that are there, but we need to make sure that they're there at all times whenever we're in contact with patients. And particularly now that we have COVID and the cases are again rising, we need to make sure that we have things that are in place for our protection and also protection for those around us. Then there's the electricity at work regulations. In 1989, it was founded, and according to this, the employers must make sure electrical appliances are maintained, they're tested, labeled as being safe. This may include computers, CPUs, they may include other switchboards that we are using. Employees must be trained on how to test electrical appliances and report faults if there are any. Then there's the Food Safety Act 1990. Anyone handling or preparing food, they have to have good personal hygiene. This has to be checked regularly. The employer should keep a record of where food has come from. Any unsafe food which is there should be disposed of, and an incident reporting should be there if there has been any incident. Then, similar to this, we have the Food Safety and Hygiene regulations, which was founded in 2013, which controls for food safety that should be there in place, maintained and reviewed. Food safety risk assessment, it should be there to identify hazards, and the environment where food is prepared or cooked should be clean and in good condition. Then we have the Civil Contingencies Act, which was founded in 2004, which establishes how organizations, I'm talking in particular about emergency services, local authorities, and health bodies, how do they work in partnership in order to respond to emergencies, and where do they share information? So we all have emergency situations. Some may be a high emergency alert, some may be low emergency alerts, but how do we deal with them if we have one? If we never have an emergency, we're very lucky, but we need to know what's there in place, who do we reach out to if there's an emergency situation. Knowing this will not harm you, it's only going to benefit you. Then we have the health and social care, which includes safety and quality. The act, which is more applicable to euplacidia, in which the care providers must provide information about the individuals that they are caring for using a consistent and identifier. You have to have an NHS number. This is to provide safe and effective care. So, for instance, if there's a person who's come with, let's say, a left hand bandage, and you're caring for that patient, so you identify that patient with their NHS number, and you have that particular complaint that they have, so that because you have multiple patients with whom you're working around, and if you are not aware of their NHS number, obviously you're prone to make mistakes. And this is why these mistakes happen, because you're not aware of this act. So if this act is there in place and you're working according to it, then you're working safe. And then there are certain convictions by certain offenses that are removed from the registers of health and social care regulatory bodies. Then you have the motor vehicles, in which you have the wearing of seat belts. This is again for everyone. This is not just for us. This would apply to domiciliary care workers that drive between clients. So although the DiHSC is the regulator for the health and safety of workers in England from 2015, the CQC became health and safety regulator for individuals who are receiving care by providers, and they are registered with them. So this HSC continues to regulate health and safety for individuals who receive care in Scotland and Wales also. HSC and CQC, they work closely alongside each other and other local authorities. This is to regulate areas where there may be crossovers or ambiguity in their areas of responsibility. So it's HSC and CQC that work together. Ofsted, we've heard a lot about Ofsted. We have Ofsted standards also to follow. This is because we are concerned with patient care, we are concerned with education, we're concerned with children's services and skills. And they inspect services providing education and skills for learners, and they may be of any age. And they also inspect and regulate services which are for the care of children and young people. There are care standards for care homes, and the fundamental standards they are in place, which include person-centered care, in which you must have care or treatment that is tailored to you and meets your needs and preferences. So you will not have the care that is applicable to another person. You will have your own specific care for your own preference and for your own need. And then dignity and respect come with everything. So you must be treated with dignity and respect at all times, whenever you're receiving care and treatment. This is for patients, this is for us also, because we ourselves also could be patients, God forbid. This includes making sure you have your privacy that you need and you would want at every time. Everybody is treated as equal, so there's no one superior or inferior to anyone, and you're given any support you need to help you maintain independent and involved in your own local community. Then your consent is very important. You must give consent before any care or treatment is given to you. You must, as a care provider, you must again ask for consent before you're offering care. And then safety, you must not be given an unsafe care or treatment or ever be put at risk of harm. We providers must assess the risks of patient health and safety whenever we are caring for them or we're treating them. And then safeguarding from abuse is very important. So abuse is not only verbal abuse, it may be non-verbal abuse. It may include neglect, which is also a sort of abuse. Degrading treatment, unnecessary or disproportionate restraint, or inappropriate limits to their freedom. Food and drink, they must have when they are patients, we have them with us. They must. It should be. We have these services in place, and they're brilliant. Where if we have a long stay of patients, we make sure that there's enough eat and drink to keep them in good health while they're receiving care and treatment. And that food that should also be according to health and safety requirements. And premises and equipment, so the places where the patient is receiving care and treatment and equipment used is should be clean, suitable, and looked after properly. And the equipment used in your care and treatment must also be secure and used properly. The complaints, whatever complaints there are about the care and treatment, those complaints, there should be a way to complain about them. The provider of your care must have a system in place so they can handle and respond to the complaints that are made. And they must investigate it thoroughly and make action if problems are identified. And then good governance is very important. The provider of your care must have plans that ensure they can meet these standards, and they must make efforts that they for effective governance and systems to check on the quality and safety of care. And these must help service improvement and also reduce any risks to the health, safety, and welfare of the patients And then you need to have enough staff, which is qualified, suitably qualified, competent, and experienced. This is to make sure that they meet the standards. So sometimes this is not possible. Staffing is not enough, but you need to make sure that whichever staff is available has to be competent enough and has to be qualified. So if you have incompetent staff, let's say, you may have 100 people working in one sector, and they might not be competent enough. So quantity does matter, definitely. Here we've seen with COVID-19 happening, and then whatever the consequences were, whatever the staff shortage was. But again, if we have competent staff, things can still be corrected. Still, there still is hope if we have competent staff and well experienced staff. Because if we just keep burdening the system with an increased number of staff, that is also a burden which is unnecessary in the system. And then the staff must be given the important support, training, and supervision. We saw the burnout of staff. We've always witnessed this whenever we've been prone to emergency situations. So they may have to have I don't know if you're sure about the term called ergonomics, where there is staff that is specially trained to be at one place. So you keep staff that is uh, particularly for that job, actually. So you fit the staff according to the job. You don't fit the job actually for the staff. For instance, if I'm not if I have a disability of any kind, so they're going to fit me according to the job. They're not going to find a job. They're actually going to find some suitable place to place me in, instead of putting me into any situation, and then that becomes hard for me. That is called ergonomics. That is a science in its own. And then fit and proper staff should be there. If you don't have fit and proper staff, obviously you're going to it's going to be hard for you also to work, and then you'll have to work for the staff itself. And then there are certain duties of candor that the provider of your care must be open and transparent with you about your care and treatment. And if there's anything that goes wrong, they must tell you what has happened, provide support, and apologize. And then display of ratings. So there should be a display of ratings as we have for Ofsted, for instance. This is for quality itself and to make people aware of what you're providing and how you're rated. Then we have the Children Act 2004. This was an expansion of the 1989 Children's Act. So this act reinforces that all the people and organizations that work with children have this duty to safeguard children and protect their welfare at all times. So the main purpose of this act is to make Britain a safe place for children to live in, to breathe in, to study in, and to cherish children, basically. And this act allowed for the creation of a children's commissioner role, which while also requiring that every local authority in the UK has to appoint a children's services director. The UK under this act has the power, the government has the power to create digital records for every child in England, Scotland, and Wales. So it makes them easy to trace, to be traced by local authorities and central governments. This is also for the welfare of children. So when they're receiving government funds, for instance, there's a good check and balance on that. Then there's the Children Act 2006. This act is to make provision about the powers and duties of local authorities and other bodies which are there existing in England in relation to the improvement of the well-being of young children. And it's to make provision about the powers and duties of local authorities in England and Wales in relation to the provision of childcare and the provision of information to parents and other persons. So if parents know about these provisions, they're more at ease and they know that the government is working for the welfare of their children. to make provision about the regulation and inspection of childcare provision in England, and to amend Part 10A of Children Act 1989 in relation to Wales and for connected purposes. Then you have the Disability and Equality Act, which is very important because when we are working in a setup, we need to know about that. So the Equality Act, it protects people from discrimination in the workplace and in the society where we work and we live in. So it replaced previous anti-discrimination laws with a single act, making the law easier to understand. And then this also strengthens the protection in some situations which were not dealt with earlier. So how do you define disability? By the Equality Act, a person can have a disability for the purposes of this act, or if he or she has a physical or mental impairment. Remember, all disabilities are not visible. So they may have a mental impairment that you're not aware of. They may have a physical impairment that you're not aware of, but that is in place. And this impairment has a substantial and long-term adverse effect on his or her ability to carry out their normal day-to-day activities. You're disabled again under the Equality Act 2010 if you have a physical or mental impairment that has a substantial, and it has to have a long-term negative impact on your ability to do normal daily activities. You may not agree with this. You may not accept, for instance, if you have a mental health, you're suffering through depression, for instance, or you're suffering from anxiety, and you don't accept as a disability. If it's hindering you from working to your best, or if it's working doesn't mean only where you're employed. It may be your home also. There are people who don't work, who are unemployed. There are parents who are unemployed. There are instances there, but they have others to deal with, and it's impacting their lives, no matter if they have children or not to deal with. That becomes more serious in itself. But even if they don't have a partner, let's say, or they don't have children to look after, it's still impacting their lives and their daily normal activities that should be there to carry out their day-to-day life activities. And then we have the Social Health and Social Care Act 2008, in which these regulations contain definitions of the services and activities that people must be registered to provide. They contain sometimes details about the stages at which different types of providers will be brought into the registration system. So this DiHSC Act places a duty on the NHS providers not to appoint a person or to allow a person to continue to be an executive director or equivalent to that, or a non-executive director under given circumstances. So the DiHSC says that the intention of this regulation is in order to prevent people from receiving unsafe care and treatment and prevent avoidable risk or harm to the patients themselves. And what is the legal framework for safeguarding? This is the main piece of legislation governing safeguarding adults in, this is the Care Act 2014. And this sets out a clear legal framework for how local authorities and other parts of the system should protect the adults, at risk of abuse or neglect. As we talked about abuse, it may have neglect as well, which is a sort of abuse in itself. So there are three legislations that are linked to safeguarding. It's Safeguarding Vulnerable Groups Act 2006. We have Health and Social Care Act in 2012. And then we have the Mental Capacity Act, which was founded in 2005. And what are these local authorities responsible for safeguarding? These have statutory responsibilities for safeguarding. As we learned about this, statutory responsibilities are legal responsibilities. In partnership with health, they have a duty to promote well-being within local communities, cooperate with one another of its relevant partners in order to protect adults experiencing or at risk of abuse or neglect. So these organizations, they just a minute. I'll just take a minute. Okay. So yeah, I'm back. So there are certain steps that are there for evaluating legal compliance. Um, you need to know, the first step is you need to know what the regulation is. You need to clarify your reporting duties. The third step is to take stock of policies. The fourth is to check your records. Fifth, it's not just about laws. Sixth step is remembering your employees. And the seventh is scheduling regular compliance checks, which should be there. These are the main steps for evaluating legal compliance that include legislative, statutory, and non-statutory frameworks in your own area. So I would appreciate if you could just take a picture of this slide, if it's possible, and then just see what in your organization, what are the policies and procedures for compliance with legislation, statutory and non-statutory frameworks. So this care service where you're working, do you know about the regulations? Do you clarify your reporting duties? Do you take stock of policies? Do you check your records? And do you check about other laws also, apart from laws? Are there other systems also in place that you're aware of? You're talking about your staff, your employees where you're working, and then do you have regular compliance checks in your place? If you're not doing it, does someone do it, and what do they include? So it will be good to share the group if you have an idea about this, and you can share it with us also. It's something good to look at. And then there are certain requirements for organizations, including Ofsted, Care Quality Commission, CQC. So the purpose of this regulation of health and social care professions is to protect the public from the risk of harm from the provision of health and social care services. And then we have Social Health and Social Care Act. We've talked about this. We have Regulation 4, which has requirements whether the service provider is an individual or in a partnership. Regulation 5 is for fit and proper persons. And directors. Regulation 6 is requirement where the service provider is a body other than a partnership. This is this is opposed to what we talked about in Regulation 4. Then we have Regulation 7, which where we have requirements relating to registered managers. Regulation 8, in which we have general requirements. This is regulation which is one of the fundamental standards. Regulation 9 is patient-centered care, and this is again one of the fundamental standards. 10 is dignity and respect. This regulation is one of, again, the fundamental standards. Need for consent is also one of the fundamental standards. 12 is self-care, safe care and treatment. Then we have 13, which is safeguarding service use from abuse and improper treatment. We have 14, which talks about meeting nutritional and hydration needs. 15, premises and equipment. 16, receiving and acting on complaints. We have 17, good governance. 18, we talked about staffing. 19, fit and proper persons employed. 20 talked about duty of candor, and 20A is requirements at the display of performance assessments. Then we have the Care Quality Commissions, which was founded in 2009. You have to have been registered for it. You have Regulation 12, the statement of purpose. 13, financial position. 14, notice of absence. 15, notice of charges. 16, notification of death of service user. 17, notification of death or unauthorized absence of a care user who is detained or liable under Mental Health Act 1983. Regulation 18 is for notification of other incidents. 19 is fee covering certain aspects. 20 is requirements relating to termination of pregnancy. 22A is form of notification to the Commission. So you can consider relationship and information sharing between local authorities and your own organization where it is applicable. So there are information that should be relevant, factual, and legible. So whenever you're sharing information, it should be relevant. And information might not be shared with other agencies and individuals safe and free from harm. So you might have to share some information, but then you need to make sure that no person is being is unjustifiably harmed in that by sharing of that information. And this information sharing is very important for safeguarding and promoting the welfare of children, young people, and adults. Sharing information to prevent abuse and neglect is important between organizations. They need to know and they have to have an understanding of systemic risks that should be there to prevent abuse taking place, even if it's never taken place, but that should be in place. There should be necessary, proportionate, relevant, adequate, accurately, timely, and secure information sharing for the purpose of which you are sharing, and it's shared only with individuals who need to have it, not everyone, and is accurate and up to date, and is shared in a timely fashion, because if it's not timely, it's of no use then, and it's shared securely. Then there is interpretation and application of prescribed documentation by local health authorities or government authorities wherever applicable. So you can look up information for your own sector, including the guidance about regulations and how to register, what incidents you must notify, and what we look at when we carry out inspections. You can put quality assurance as simple as this, that it's focused on measuring and reviewing the quality of the services that you offer across the whole organization. And this is important because it allows you to see where there are improvements that need to be made. Because if you don't know the ground realities, you won't know how to improve from there. So there is an aspect where we identify areas for change or adaptation and develop plans to improve policies and procedures where they are deficient in our own area. So there are healthcare leaders who set goals for their organizations. So you have patient falls that you are going to prevent, or a medical care system aims to lower opioid use after surgery. And there may be any other quality improvement measure. This is there in the NHS. There's a simple guide to improving services. It's there on your Moodle page, and you need to take your own organization and develop a plan to improve policies and procedures wherever they are deficient. So you can talk about a particular policy which requires change or improvement, as guidelines given have not kept to changes with time, and the procedures or guidelines given are outdated. And it should not, it might not have met the updated government legislation or the company's requirements, and what changes are required to be made to bring it in line with the requirements. So this is something also that you can be doing in your own area that you find there is any deficiency. These are some of the references that you follow. You can refer to your ebooks and journals on for this unit. If you have any queries, questions, if you want the recording of this session, you can always email here. These emails have been given. The assignment session is after 2 weeks of the completion of the unit and its delivery. So we'll talk about these assignments also. These are some more of the fundamental standards. So CQC, we talked about. These are the minimum standards that must be met by all regulated health and care providers, and they're aligned closely with the regulations. And these are person-centered care, dignity and respect, consent, safety, safeguarding from abuse, food and drink, premises and equipment, complaints, good governance, staffing, fit and proper staff, duty of candor, and display of ratings. We've talked about these earlier. And KLOES is an acronym for key lines of inquiry and sets of inquiry and sets. So it's out. It shows main areas that CPC will look at while they're going for an inspection of a service. So what are the 5 areas? Safe. You ask if you're inspecting some area for quality and care. Is it safe, effective? Is it caring? Is it responsive? And is it well led? Then the Equality Act 2010, it protects individuals from discrimination based on 9 characters, which includes age, gender reassignment, disability, sexuality, marriage or civil partnership, pregnancy, maternity, race, and religion. So all organizations, they have to ensure that they comply by this legislation. Then you have the Care Act 2014, which was reformed how care is assessed and delivered. It made a local authority responsible for assessing anyone who may have the requirement of care services and give individuals more choice over how their care is being delivered. And this focuses on personal outcomes and well-being. There are also provisions for carers, as well as a great emphasis is there on prevention, protection, and safeguarding. Then you have the Safeguarding of Vulnerable Groups Act 2006. This helps to avoid harm to children and vulnerable groups by preventing unsuitable people from working with them. You have the DBS checks, which employers use to check that their employees are not prohibited from working in a care role. Then you have the Mental Capacity Act 2005. This provides protection for individuals that may not have the appropriate mental capacity in order to make decisions for themselves. There are certain 5 statutory principles that are set out in this act. So it says that a person must be assumed to have capacity unless it is established that they lack capacity. A person is not to be treated as unable to make a decision unless all practicable steps are there to help him to do so have been taken without success. So you've not had any success while you've carried out all those steps. A person is not to be treated as unable to make a decision just because he makes an unwise decision. No, there should be proof that he cannot make a decision. An act done or decision made under this act for or on behalf of a person who lacks capacity must be done or made in his best interests. So you have to have that person's best interests in it. Before the act is done or the decision is made, regard must be had to whether the purpose for which it is needed can be as effectively achieved in a way that is less restrictive of the person's rights and freedom of act. So it shouldn't be harmful for that person instead. This also sets out the criteria for assessing mental capacity, where you ask, does the person have a general understanding of what decision they need to make and why they need to make it? Does the person have a general understanding of the likely consequences of making or not making this decision? Is the person able to understand, retain, use, and weigh up the information relevant to this decision? Can the person communicate their decision? This is by talking, using sign language, or any other means. Would the services of a professional such as a speech and language therapist be helpful? Then you have the Mental Health Act, which was founded in 1983, and this was this is an amendment from 2007, which covers the assessment, treatment, and rights of individuals that have mental health disorders, which include detainment if there is a risk of that an individual may harm themselves or others around them. So there is a liberty protections, safeguards, which protect the rights of individuals in care homes or hospitals who are deprived of their liberties. This should be in their best interest to be given the care and treatment that they need. And this ensures that there is a robust system in place for the authorization of restrictive systems by a hospital manager, CCG, or local authority, and there are provisions, legal recourse by affected individuals. That's it from my side. Any questions? You can always use Moodle. Yeah. And I will be talking about soon. I'll be talking about the requirements for your assignments. That is obviously after the 4 LOs have been complete. So the 5th learning objective will be basically focusing all on how do you have to do your assignments and what is required from you.
Okay, thank you.
I hope this makes it clear. Any questions again? It's been a long session. We don't have much time to discuss these in detail, but you can always chat with me on Moodle if you want. If you have any questions, if you want these presentations or these videos to be there, these recordings to be there, you can always discuss that also on that forum.
Okay, thank you, ma'am.
Thank you so much, Presidia. Have a wonderful week, and I'll
Okay.
see you on Saturday.
Okay, ma'am.
Okay?
Thank you,
Take care.
ma'am.
Take care.
Bye.
Bye.